enter the patient's room and I would perform hand hygiene first. I would ask the patient to state his name and date of birth for me to make sure I had the correct patient. Today he's going to go by JW. So I'm Lauren, I'm your nurse, and I'm going to be doing your head and neck exam today. I'm going to start at your head, moving down to your eyes, ears, nose, mouth, and neck. If you have any questions along the way, please feel free to stop me, and I'll be happy to answer them, okay?
Okay.
So I am first looking at his head, looking at the hair distribution, looking at the shape and the contour. I'm going to go ahead and palpate, feeling for any lumps, bumps, depressions, and I would say that his head is normal cephalic. Now I'm looking at the face. I'm looking for symmetry, which his face is symmetrical. I'm looking for any involuntary movements. He doesn't have any lesions or scars. Now I would feel the temporal artery, feeling for that temporal pulse on both sides, and then moving down to the temporal mandibular joint. If you could open and close for me one more time. Okay, and there wasn't any range of motion issues. Now I'm going to feel your sinuses. I'm feeling the frontal and the maxillary sinus. And as I do this, just tell me if you feel any pressure or pain. Any pressure or pain when I push?
Nope.
Thank you. So now I'm going to go ahead and move to the eyes. I'm looking at the sclera, looking at the coloring. I'm looking for white eyes, which he has, and I'm making sure there isn't any yellowing or jaundice of the eye. Now I'm going to pull down on your lower lids. As I'm doing that, I'm looking at the coloring. It is a nice pink color. If it was pale or whitish, then that would be something that would be a concern. So now I'm going to grab my light source, and I'm using my otoscope. I'm just shining this kind of onto the side, looking for any foreign bodies in the eye. And as I go back and forth, I'm also looking at the symmetry. Now I'm going to be checking his pupillary response, looking to see if they're equally round and reactive to light. I'm going to be checking the direct and consensual light reaction. So I will be pointing the light into your eye twice on each side. And so as I do that, I'm going to start with the left eye. I'm shining the light into the left eye, looking at the left pupil to constrict. Now I'm doing it again on the left side, but looking at the right pupil this time. They both constrict. And now I'm going to move to the right eye, pointing the light in, looking at that pupil, it constricts, and now doing it again and looking at the left pupil this time, and it constricts. So now I'm going to test your peripheral view. So they do this by, I guess it's called confrontation. And just continue to look forward at me and just tell me when you can see my fingers.
Now.
Okay, and now I'm going to move to the superior and posterior views and doing the same thing.
No.
Okay, and again.
No.
Perfect. So your peripheral view is intact. Now I'm going to check the 6 cardinal views of gaze. Just following my finger. Lateral, high, low. Going back to midline, across, high and low. Perfect. So now I'm going to test to see if his eyes converge. So just follow my finger, and I'm going to be bringing it towards the bridge of your nose. Great, and they converge. I go about 5 to 15 centimeters from the bridge of his nose. While I was doing that, I should be looking at his eyes to see if they constrict as my finger gets closer. But if I can't do that or I can't see it, I would do the NIRS test. So to do that, I'm going to have you pick out something on the back of the wall, and then look at my finger, and now look at the back of the wall again. Okay, great. So I'm just checking to see if his eyes dilate when he looks at the back of the wall, and then if they constrict when he looks at an image closer. So that completes the basic eye exam. Now I would do the fundoscopic exam, but since I don't have an ophthalmoscope, I'm just going to explain what I would do if I had one. So I'd have the patient look forward. I would move to this side. I'd do it about a 15-degree angle. I would place my left hand on the patient's right shoulder, and I'd take the ophthalmoscope and put it on my right eye if I'm checking his right eye. I'm looking for the red light reflex in his pupil, having him look straight forward, and then I would move and get as close as I could until that red light disappears. At that point, I'd be able to see the blood vessels in the back of his eye, and I would follow those blood vessels and I'd be able to see the optic disc and the physiologic cup. If I move slightly nasal, I'd be able to see his macula. Then I would move to the other side and I would do the same thing. So that completes the eye exam. So now I'm going to go ahead and move on to the ear exam. So, of course, first inspecting, I look at the symmetry. They're both symmetrical, at the same height. I'm looking at the outer ear canal, looking for any drainage, any redness, looking at both sides, looking for any signs of inflammation or infection. Now I would perform the whisper test. If I'm going to occlude his ear, and then I'm going to say a 2-syllable word, and then I'm going to have you repeat it back to me, okay?
Apple.
Great. And now I'm going to do it on the other side.
Baseball.
Great. So now I am going to do the pull test, and I would take the pinna and I would pull up, back, and down. Was there any pain or tenderness when I did that? And I'm going to do it on the same side, up, back, and down. Any tenderness or pain?
No.
Great. If he did experience any tenderness or pain, that could be a sign of infection or inflammation in the inner ear canal. And I'd want to do this before sticking something into his ear. But since he didn't experience any, I'm going to go ahead and get my otoscope, turn on the light. I'm going to pull the pinna up and back for an adult, and then for a child, I would pull back and down. And this just opens up the ear canal so I can see further into the ear. So when I'm looking in the ear, I'm looking at the coloring, looking for any lumps or lesions. I'm looking for a nice pearly white color, and which his coloring is great. Pulling it up and back. Great. So I also was looking at the bony prominences, the malleus, the umbo, and just looking again, seeing if there is any redness. I would now conduct the Weber and Wren test if I had a tuning fork, but since I don't, I'm just going to explain what I would do. The Weber test conductivity. So what I would do is I would strike the tuning fork and I'd place it on your forehead. I would ask you if you could hear or feel that vibration, and ask you which ear you could hear it in or feel it in. You would want to hear it in both. Usually, if you didn't, if you heard it on one side or the other, that could be a sign of hearing loss. Then I would test the Wren, do the Wren test, and I would strike the tuning fork and I'd place it on the back of the ear on the mastoid bone, and I would ask you to tell me when you stopped hearing it or feeling it. Then I'd place it in front of your ear and I would ask if you could hear it. And if you did, that's what we would want, because ear conductivity is greater than bone conductivity. So that would complete, and then I would do it on the other ear. So that completes the ear test. Ear exam. And now I'm going to take, I'm going to do the nose. Excuse me. I'm looking at, to make sure that it's midline. I'm looking for any drainage, any inflammation. I don't see any. The nose is midline. So if you could just tilt your head back, and I'm going to take my non-dominant hand and I'm going to pull up slightly, taking the light, been inserting it slightly in the nose. I don't want to go too high in there because I know that it is very vascular. And I don't want to break any blood vessels. I'm looking at the mucosa, looking at the coloring, looking to see if there's any lesions. No lesions. The nose, like I said, is vascular, so it is going to be a little bit red, but it's going to be less red than the throat is. I was also looking at the septum, making sure there wasn't any septal deviation, which there wasn't. So now I'm going to move on to the mouth. I'm looking at the mouth, looking to see if there's any cracking, any lesions, or any lumps or anything on that, which he does not have. Now I'm going to go ahead and examine the inside of the mouth. So I'm having him open his mouth. I'm looking at the mucosal membranes. If you could go ahead and stick your tongue out and say ah.
Ah.
I'm looking at the uvula, making sure it's midline, looking at the tonsils, looking at the pillars. Great, if you could. Now I'm just looking at the hard and soft palates, again looking at coloring, looking for any bumps, lesions, looking at the dentation. Okay, great. If I had a glove, I'd go ahead and put that on and I would feel his cheeks, seeing if there's any masses in there. If you could go ahead and lift your tongue, I'm going to look at the submandibular duct and the sublingual duct. Those look great. Okay, you can close. So now I'm going to move on to the neck. I'm looking to see how the neck lines, looking to see if the trachea is midline, seeing if there's any torticollis, which there isn't, which is a curvature of the neck. And I'm going to go ahead and palpate the lymph nodes now. I'm using my 2 to 3 of the pads of my finger. I'm going to go in a circular motion. I'm starting at the preauricular lymph node, moving to the postauricular, and I'm feeling for any a pea-sized lymph node that's mobile and non-tender. Now I'm moving to the tonsillar, the submandibular, and the submental, the interior cervical, and the posterior cervical. Then I'm going to do the deep cervical, and I'll have the patient turn their neck. So if you'll go ahead and turn your neck, and I'm feeling for that. And again. And then I'm doing the supraclavicular and the infraclavicular, and then moving back to the occipital. And did you have any pain or tenderness with that? Okay,
No.
Great. So now I'm going to be looking at the trachea and the thyroid. So I look at the trachea, it is midline. I'm going to go ahead and place it to one side, and then the other, it is, I'm able to displace that. So now I'm going to do the thyroid, and I'm going to move posteriorly. You can examine it in the front as well. So I'm going to take both hands, I'm going to place them on the side, palpating to see if it's midline. And then if you could swallow for me. Great. So also I was looking for if there was any goiter. I would be able to see it or palpate it, and I did not notice anything. So that completes my head and neck exam on my patient. Did you have any questions for me?
No.
All right, great. Thank you so much.